As a person with cystic fibrosis and as a person who represents other people with the same disease, I hear a lot about people's different experiences, and not everybody's pharmacy experiences are the same. And people with CF talk to other people with CF, so we're all aware that we're not getting the same service that we should be getting. I'm also pleased to hear about joined up care, at the risk of sounding like Andy Burnham. Integrated care and whole person care, I think I do agree with him on that, and I certainly don't feel that I get that currently. So for example, some of my cystic fibrosis drugs are quite high cost and so are not prescribed in the community, they're prescribed by my hospital. Now the hospital, I don't pick them up at the hospital because I don't go there every week, so they're delivered to me at home. Now, I'm a person, not a patient, and I have a life. I seem to think that NHS is the same as the local council, because I live in a council house. I don't have a job, therefore I can be in all day. And the NHS seem to feel the same way, is that I'm a patient and I'm poorly, therefore I haven't got anything better to do than to wait around for you to deliver it. And so I got a bit annoyed waiting around for my medicines to be delivered and asked if I could have them delivered to my local pharmacy. And they was like, oh yes, that's a really good idea, that's fine. Which pharmacy do you collect your medications from? So I told them, oh, we can't deliver to that one. So I'm still stuck waiting. I don't think that the services that community pharmacies can provide are particularly well advertised to those with long-term conditions. My husband bullied me into having a medicines use review. And I thought, oh goodness, what sort of waste of time is this? But if it gets your pharmacy a bit of money, okay, I'll do it. And actually, I was really, really pleased that I did it, because when I go to clinic, the people that look after me at hospital are so concerned with seeing me, making sure I'm well, sending me on my way. Here's a new drug, take this, okay, I will, off I go. No one has time to sit down and tell you what those medicines are for, why you were prescribed them, and why it's so important to take them. And having had that review, it actually made me realise a few things about my tablets, me thinking I knew everything about CF. Made me realise that there was things still to learn and that I didn't understand, and had actually improved my compliance. Pharmacies don't ask people what they would like and what their experiences of pharmacy are. In hospital, you ask all the time, patient satisfaction survey, what have we done well? And I don't mean when you go into your local pharmacy and please rate me today, how was your service, you could win an iPad type patient survey. I mean a meaningful one where you can actually give your experiences and what you would like your experiences to be. I tweeted earlier that I was coming to this event today and asked, and I have quite a few followers, all of whom most have some experience of using health services, and you know, could you let me know your experiences? I'm going to be going to this great event tonight and I can share your voice, and not one person got back to me. If I had tweeted about, tell me about your hospital services, I would have been inundated with responses. So I just don't think we ask people enough. I was also a bit scared about the word transformational before I came today, because I always think transformational is like all big ideas and what they're going to do, which are all very good. But I think for most people using pharmacy services, it's the little things that are important to get right. So they may not seem to you guys as transformational, but for us they might be transformational. So going back to the inequality thing, some people with CF are allowed to have their drugs home delivered and others are not, because they fall outside the criteria. So maybe we need to rethink that criteria. I might not be housebound, but I spend a lot of time on my medication and on my treatment. You know, it takes a long time to look this good, frankly. So if I could have them delivered at a time that is convenient to me, that would be one less burden and maybe help improve my compliance. I also think, I was glad to hear about pharmacies trying to improve adherence to drugs. I struggle myself, although it's very difficult now, being married to who I'm married to get away with things as much as I did. My sister-in-law once caught me pouring a nebulised solution down the sink, and as you can imagine, the scene that followed. However, my CF team don't have the time or resources to try and help me with my adherence problems, and I really feel that's where hospital pharmacy or community pharmacy could come in.